Every time I'm, working with a patient who maybe is a little more high profile like this or in the public, we're always on our A game, regardless of if they have one follower or a million. First off, she's been very public about her recent surgery with me. And I was blown away by the actual response that like all the media outlets, I mean, first off, they love Lindsay Arnold. Like People Magazine, they wrote like 3 or 4 different articles. Every time she'd post a new TikTok updating about her breast augmentation, breast lift surgery with me, they were writing articles about her. And so I think ever since she was on Dancing with the Stars, and she's had a couple of kids since then and hasn't returned, but they love her to death. And I've had people sending me articles from like Entertainment Tonight and Daily Mail, all over the place. But the cool thing is like she has just been so open about why she did it and her whole recovery and just kind of the day-to-day of what it's like to prepare for that surgery, to have a breast lift augmentation, and then to recover from it. And so it's been really cool to see that. She talked about even the Motiva implants that we use for her, the Demi profiles. And it's been really cool to just see people message me, and I'm sure messaging her, just about wanting to know more about breast augmentation surgery. So I love that someone like her, who's very well known, was willing to share about it.
Yeah. I mean, in the media, they absolutely eat up anything that has to do with celebrities possibly having something done, let alone actually talking about the process themselves. So I'm not surprised that it's hitting the news cycle constantly every time that she brings it up. So how did you initially connect with her? Did she just call the office, or she DM you? How'd that go down?
Yeah, I get a lot of DMs, but it's a lot of times it's through like patients that, it's like a referral through a referral. It's a lot of times how I get a lot of these patients, or just a lot of my patients in general. I mean, some people do slide into my DMs, but yeah, hers was, through other people that we mutually knew. And they don't live too far from where I currently live. Salt Lake's just a small community. And so, they live like down the street from us pretty much. So that's how it worked out. But
just your friendly neighborhood plastic surgeon.
Yeah, it kind of feels that way sometimes.
Yeah. So how did that work out for you seeing her in consultation? I mean, do you have butterflies seeing people like that, or is it such a consistent thing for you nowadays that you just don't get nervous when you're meeting new people for consultations?
I do get actually quite a few, and the funny thing is they don't talk about it, right? And so I can't talk about the other celebrities and other people I've worked on unless they're sharing about it. Lindsay's been very open and shared about it and has told everyone that I'm her plastic surgeon, so I can talk about it. But yeah, so I don't know, I don't get butterflies. I think the first time, like someone came in, definitely fanboyed, the whole office, but like we try to stay very professional, very nice. And
you don't stop them in the hallway for a photo?
Yeah, no. I do like to do TikToks with them, though, if they're open for it, Yeah. But again, a lot of times they don't want to share. And that's obviously total HIPAA and privacy. We respect that. But the cool thing is, if they're willing to talk about it and share their journey, I mean, I think a lot of people are like, oh, they're celebrities, so they're coming to you and you're doing it for free. And I've never done that, just for the record. I think we talked about this on a previous podcast. But people that are willing to share and talk about it's because they're happy. Like I don't ever make anybody sign anything like, oh, you have to share this and I'll give you a free surgery. Like that's just not how we operate our practice. And so everyone that shares, they want to talk about it. And so I do think as well for a lot of, not even just celebrities, but like influencers, it gives them an opportunity to have a soapbox for a little bit, or even just kind of share a new journey for them, right? And it's more content for them as an influencer, and it draws a lot of people, whether it's good or bad attention. Definitely gets the engagement up anytime they talk about plastic surgery, like you mentioned, right? Like even the news, they eat it up.
Yeah. Well, it's good content. Yeah. I mean, especially for them, if it's something new for them and they can document the entire journey from start to finish. I mean, if it ends great, awesome. But you also do see a lot of these journeys where people don't have a great outcome and they almost seem to get more out of it content wise, especially for people who've had, massive weight loss journey. They've lost all the weight. Like, what are we going to do next? And then they do their plastic surgery journey. And if it doesn't go awesome for them, they seem to drag it on for like months to years while they're getting things fixed up. And I guess that part of that is to continue to produce some of that content. And I guess you're right in saying that it's helpful for them as well.
Yeah, I mean, it is a little scary, right? I mean, it's kind of double-edged sword. Like, if they have a good experience, surgery goes well, which most time it does. But if it doesn't, if there's a complication, which we know can happen in plastic surgery, regardless of the surgeon, the patient, the situation, that could go south for you, your reputation. So definitely every time I'm, working with a patient who maybe is a little more high profile like this or in the public, yeah, I got to be, we're always on our A game, regardless of if they have one follower or a million, but yeah, I mean, everyone has a voice and everybody, I think, deserves to be heard. And as, physicians, we always listen to them and what their needs and their goals are. And if it's not achievable, I've had some celebrities come in and just want stuff that I did not see eye to eye with, or I feel like I couldn't deliver that safely, and I declined to do the surgery. And I've had that a few times too. It's just, to me, not worth what could happen if I can't meet that expectation, which I just didn't think was reasonable,
Yeah, well, especially if somebody has a really large following, if you don't want to put yourself in a situation where you're not going to meet their expectations, because then they will share that very publicly, which could be very damaging to you, especially in these situations that you talked about. We're set by HIPAA to not talk about things in a public forum. So unless other people kind of give us a release to do so, it's a little hard to defend yourself.
Yeah, really, our hands are tied. Like, we can't talk about, and sometimes the way that a patient interprets something may be different with how you interpret or see it, right? There's three truths. There's like your truth, their truth, than the actual truth. And so, but people are going to listen to the patient's truth a lot of time, and we're not allowed to say anything, and we have to respect that. But it does make it really hard, for sure.
Yeah. Now, on some of the social media content that she had, she talked about how she let you decide the final sizing for her. Did she give you like a range to work within, or was she just like carte blanche, do whatever you?
No, I always have a 3 implant size range for patients. So what we do is I do, probably like you, base width, base measurement planning. And so if someone's width is 12 centimeters, we'll find the size that they want, the profile they want, what fits their chest, and then we go up a size, down a size. So we always have a 3 size range. So for example, hers was like a 265, 285, and then like a 245. And then I always start with the smaller size, and then we work our way up. But I always say we're never going to go out of our range. So it's a predetermined range that the patient has agreed upon. I actually we have them sign what's called the surgical acceptance form. It's not a contract or anything, but essentially it lists every single thing that we are planning on doing in that surgery. And they've already done the consent forms, but this just bullet point says, okay, we're doing a breast lift, we're doing a subfascial augmentation, we're doing internal bra, and then we're doing this motif implant, demi profile, and there's 3 sizes, and they sign off on that. And so that's how we pick. And I start with the smallest, and I kind of work my way up. If it feels like it's going to be too big, too wide, or whatever, we kind of stop in the middle. So for her, we did 265.
Yeah. And the sizes you're picking, I'm assuming, is that all within the same profile, or are you picking ones that are different profiles as well?
It's usually the same profile. Now, so rarely there's some patients who are like borderline, like given their measurements, we're like, okay, they're like, well, I maybe want a 210 or I maybe want a 240. And a 210 in, let's say, a moderate, it might be a little too narrow, look a little funny. So sometimes we'll say, okay, well, if you want to actually go to the 210 and that fits you, we may have to go down a profile to like a low plus to fit your frame, right? So it's like this kind of balancing. Because I think there's certain kind of volumes that are like on the cusp that you could go either way. And so we talk about that ahead of time, and then we'll plan and say, okay, if we looks like we're going to do the 210, we're going to go with the low plus. If we're going to do the 240, we're going to do the moderate. So it can be different profiles, but again, it's only going to be 3 sizes. We're not picking a bunch of volumes.
Yeah.
How do you do it?
You don't bring an entire truckload in.
No, I can't. No. I mean, we have all the consignments, so we have all the implants, but yeah, we just bring the ones in the OR that we're going to use.